Good to see you again. Yeah, in this video, we are going to be doing a full mock on a patient that is having congestive cardiac failure. It's going to be on assessment, planning, implementation, as well as evaluation. Without further ado, let's get started. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be looking after you today. How are you? Right. The reason why I'm here is to carry out a full set of observations on you, following A to E approach, and to ask you a few questions about your activities of daily living. Is it a convenient time, place? All right, before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, I have Janet James. Janet James, your date of birth is 0101 1992. 0101 1992. Your hospital number is 1234567. 1234567. Perfect. I have it properly documented here. Right. Are you allergic to anything at all, please? Okay, it is properly documented in my notes that you have no known allergy. Right. How may I address you, please? All right, Janet is fine. Okay, Janet. So, assessor, I can confirm I am with the right patient and I'm happy to proceed. All right, Janet. I will be stepping aside now to gather the equipment I'm going to be using for this assessment. Right. Should you need me before my arrival, here is the call bell. Do press on it and I'll be here to attend to you. Is that okay? Right, thank you. So leaving my patient, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm my equipment are clean, calibrated, and are ready for use? All right, thank you. All right, Janet, I'm back. Are you still happy for us to continue, please? All right, I will be starting with a full set of observations now. Right, then we'll proceed to A to E later. Is that okay? Right. All right, Janet, I'll be starting with your blood pressure. Which of the arms would you prefer? Okay, all right. The left one. All right, that's good. Could you please confirm with me if you've had any surgery done on this arm? Oh, not at all. Good. So I can see there is no sign of infection on the arm and the arm is visibly clean. I'm sure I have the right size of cuff. So I'll go ahead now and apply the cuff to your arm 2 to 3 centimeters away from the cubital fossa. I will make sure it's not too tight and it's not too loose. As soon as the machine starts working, you may feel a little tightness around your arm. Right, do not worry, it's going to be for the time being. Is that okay? Right, so I'm not going to start the machine now. Can I use your other arm, please, to check for your capillary refill? All right. Checking the fingers now, I can see there is no sign of infection, no false nail, no nail varnish. Fingers are visibly clean. Right. So I'll be depressing your fingers now for 5 seconds. 1, 2, 3, 4, 5. All right, that's good. I'm happy it returned in less than 2 seconds, meaning you're properly perfused. Right, then I'll go ahead and put the probe now, then start the machine. Right, so I'll go ahead and document that your blood pressure is 120 over 80 millimeter of mercury. Good. Your SpO2 is 95%. Right, so I will go ahead now and unwrap the cuff. Remove the pulse oximeter and keep it aside. I will be cleaning that later. All right, Janet, in the next 2 minutes, I want you to be silent while I check your heart rate. This time, I will not be talking, all right? So I'll go ahead and palpate to check for the radial artery, all right? Okay, so assessor, my time starts now. All right, Janet, I'm so sorry. I actually checked your heart rate for 1 minute, and the other minute I checked your respiration. I was intentional about not informing you because I don't want the reading to be altered. I'm so sorry for this. All right, thank you very much. Here is an infrared thermometer, Janet. It's not going to come in contact with your skin. It is a device that is used to check temperature. Looking at Janet's forehead, there is no excessive sweating. There is no form of inflammation. So I'm happy to check Janet's temperature. Right, your temperature reading is 37.2. Moving on to A to E assessment now. The first letter is A, which is airway. Since the procedure began, you've been talking to me in 2 to 3 sentences. I don't want to assume your airway is patent. Could you please make a cough to further establish this? Oh, great. Can you take a deep breathing breath for me? Fantastic. So, assessor, I can confirm Janet's airway is patent. So, moving on to B, Janet, the other time I checked for your respiration, I was checking for the rate, the depth, right? The rate, I got 28 circle per minute, which was on a high side, but do not worry because I can see you are not breathing at ease, but that is why you are here. You are in a safe hands, and we are going to do everything in our capability to make sure you are good again. Is that okay? That is why you are here. All right. Do not worry about that. Okay. Talking about your ear entry, the rising and falling of your chest bilaterally is normal. Right. There is no problem with that. Moving on to respiratory noises. There was no wheeze sound, stridor, or coughing. There was none of this sound heard during the assessment. Moving on to visual signs of respiratory distress. Obviously, Janet, you are using your accessory muscle to breathe, meaning you are in distress right now. Like I said earlier, do not worry, you are in a safe hands, and that is why you are here. Let's moving on to your SpO2. The other time I checked for your SpO2, I got a score of 95%. You're scoring 1 on that, but do not worry, everything is going to be taken care of. Is that okay? Right. Moving on to your circulation. The other time I depressed your fingers for 5 seconds, and I'm happy it returned in less than 2 seconds, meaning you're properly perfused. Looking at your extremities, you are not too warm and you are not too cold, meaning there is proper circulation. Right. For your heart rate, the other time I checked for the depth, the strength, and the rhythm of your pulse, it was within normal therapeutic range, and the heart rate I got was 72 beats per minute, which was okay. Moving on to D now, which is disability. Janet, do you know where you are at the moment? Oh, good. Hospital, that's correct. Yeah. And do you know who I am? Oh, yes, fantastic. I'm actually your nurse. That's good to know. Right. And do you know what time of the day it is? Oh, great. It is actually noon time. Well done, Janet. Right. Right. Can I confirm with you the last time you visited the loo? Oh, was about an hour ago. Good. Do you experience any pain while using the loo? Oh, not at all. I'm happy about that. Right. So, assessor, could you please confirm Janet's blood glucose level and the last time it was checked? All right, thank you, assessor. It was checked at early hour of today. Oh, good. And it is within normal therapeutic range. So, all right, Janet, I'm happy to hear about that. Okay, Janet, can I confirm with you if you are in any pain at this moment? Oh, so sorry to hear that. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, Janet? Oh, you will say 7. That's quite high, Janet. I'm so sorry to hear this. Assessor, if it were to be real clinical settings, Janet seems to be in a serious pain now. I would have loved to leave what I'm doing and attend to Janet. But for the purpose of OSCE, could you please allow me to continue? All right, thank you very much. Okay, Janet, I'm so sorry to hear that. Where exactly is the pain? Could you please point to where the pain is exactly? Oh, in your heart. and are on your legs. I can only imagine how difficult this time may be, Janet. Oh, so sorry. How do you feel within your heart? Oh, you feel your heart is racing and panting like a horse. I can only imagine. So sorry to hear this. Oh, so sorry to hear this. And on your ankles, oh, they're actually quite painful. I can see they are a little swollen. Do not worry, you are in safe hands. Okay, I'm here to take care of you. Is that okay? All right. Okay, so sorry. Can you manage? Is it okay to support your back with pillow? So sorry. Can I reposition you a little? So sorry. Is it okay to place pillow underneath your foot? So sorry, Janet. I'm so sorry you are passing through this difficult moment. We are going to do everything to make sure you are fine again. Is that all right? Can you still manage, please? Are you still happy for me to continue? All right, so sorry. All right. So I'm going to be checking through your match chart in a moment to see if you are due for any analgesia. And if you are not, I'm going to be escalating your care. And as soon as analgesia is prescribed, I will come back to administer the medications to you. Is that okay? All right, thank you. Moving on to E, which is the exposure. The other time I checked your temperature, it was okay at 37.2. All right. And in a part that is exposed in your body, I cannot see any sign of bruises, bleed, or injury. Okay, except for your ankles that are swollen. Right. And you said that you're having pains in those ankles. Do not worry, you are in safe hands. We are here to attend to you and make sure you are as comfortable as possible. Is that okay, Janet? Could you please confirm with me if there are any other part in the part that is covered in your body, if there is any sign of bleed, bruises, or injury, please? Oh, there is none. All right. Thank you for your time. That brings us to the end of A to E assessment. Okay. A quick one on your past medical history. Checking through your notes now, I could see you have congestive cardiac failure, which may be a contributing factor to the reason why your heart is panting and racing like a horse. Okay. So I could see also that you are on medication for that, which is digoxin. Digoxin is going to be of great benefit to help you on this, okay? So if I may ask, Janet, how well are you complying with your medications? Oh, great. I'm impressed on that. I just want to encourage you to still keep up with your medications because the more we take medications, the better for our health. Would you be willing to do this, Janet? All right. Thank you very much for your time. I'll be stepping aside now and I'll be back in a moment. I want to quickly document what I've done with you and come back to relay the findings. Is that okay? Thank you very much. Here is the call bell should you need me when I'm away. Is that okay? All right. Leaving my patient bedside, I will go ahead to perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still comfortable, please? Okay. So I come up with total new score of 4. It is nothing to worry about. In your respiration, you have a respiratory rate of 28 cycles per minute. That gives you a total score of 3 in a single parameter. It is quite high, but I don't want you to be overly bothered because we are going to take care of that. Is that okay? And for your SpO2, you're saturating on air, you score a score of 1 there. It was quite low, but not too bad anyways. It was 95%. Okay, do not worry. Everything is going to be properly taken care of. Is that okay, Janet? All right. Few questions about your activities of daily living. How do you mobilize, if I may ask? Oh, good to know that you mobilize with the aid of Zimmer frame. Good, right. And I hope you are comfortable using that. Oh, good to know. And how is your sleeping pattern? Do you sleep well at night? Oh, so sorry to hear that. You are not always sleeping well because you are always anxious as your heart races at night. I can understand this perfectly. Do not worry. With your permission, Janet, Is it okay to refer you to sleep therapist? All right, thank you for giving your consent on that. I'm going to be noting that down and I will escalate this. Right. Okay. Are you eating and drinking all right? Oh, good. Good to know. Good to know that you're drinking and eating all right. Okay. Regarding your psychosocial, I could read from your scenario that you live alone in a bungalow. Right. How is running errands with you? Do you need any assistance of social workers on that? Oh, you don't actually need them because your friends does come around to assist you. Fantastic. Good to know. Do you practice any religions at all, if I may ask, Jeanette? Oh, you don't, and you don't want to. I quite understand that. That is understandable. Okay. There is no problem whatsoever regarding that. Right. Do you want to say anything about your sexual life? Oh, you don't want to talk about that. That's good. That's good to know. There is no problem at all. Right. So I could see that you are breathing with some level of difficulties and you're using your accessory muscles, obviously. With your permission, Janet, is it okay to refer you to respiratory team? All right, good. Good, good. I'll be noting that and I will escalate. Right. You said the other time that you are anxious. Are you still anxious? Oh, okay, there is no problem. With your permission, is it okay to refer you to psychotherapy team? All right, I will definitely be referring you, right? And I will note everything we have discussed in the course of our conversation today, and I will escalate appropriately. Is that okay, Janet? Do you have any other questions for me apart from all of this we've addressed? Okay. All right. It's okay. Yeah, I understand that you are anxious. Do not worry. Everything is under control. You are in safe hands. Okay. All right, Janet. Here is the call bell now. I'll be leaving you now. Should you need anything, press on the buzzer and we'll be here to attend to you. Is that okay? All right. So leaving my patient's bedside, I'll go ahead now and clean the used equipment in preparation for the next use. I'll go ahead and perform my final hand hygiene following the 7 steps of WHO standard. All right, colleague, that brings us to the end of assessment. Now, let's move on to the planning station. In this station, we'll be writing 2 nursing care plan. I'll be stepping aside quickly now to document the nursing care plan as well as the interventions. And as soon as I'm done with that, I'll come back to read whatever I might have written. Right, with that being said, I will be right back. That was hot. Yes, it was quite hot. Yeah, I've come up with 2 nursing care plans. Yeah, sit back and enjoy it. The first nursing problem is Janet is having difficulty in breathing due to congestive cardiac failure with a respiratory rate of 28 cycle per minute. Somebody will ask, how do you come about that 28 cycle per minute? Remember, during the assessment, while checking the patient respiratory rate, that was the score we got. So my aim of care for Janet is Janet will have normal breathing pattern with respiratory rate of between 12 to 20 cycle per minute following nursing interventions. Your aim of care should be realistic, right? It must not be something vague. Okay, so to be on a safer side, setting range for yourself is the best. The reevaluation date for this patient is today, the date of your exam, in bracket open and close. This is important. It is non-negotiable. You must not forget this part. Right. Every hour or sooner if the clinical condition changes. As simple as that. Right. Simple, isn't it? So your intervention now using Immatarid, like I always say, Immatarid is your surest plug. Yes. To make your nursing care plan to be easy, and simple as ABC, you need to embrace a matter read. Yeah, the first letter there is E. Explain and discuss all aspects of care to Janet and obtain consent. That settles E. M, you monitor and record Janet's vital observations, especially her respiration, every hour, and escalate as per News 2 policy. Remember, during the assessment, we came up with a total score of 4, where Janet was scoring 3 in a single parameter. That has override whatever score you are getting. Of course, if it is higher than 4, from 5 and above, it requires immediate attention. Ideally, if it were not to be 3 in a single parameter, if the patient has gotten all of these scores in different parameters to sum up to make it up to 4, the frequency of monitoring will obviously be between 4 to 6 hourly. You understand? But the moment you have 3 in a single parameter, that has override whatever score that you are having. Okay, so any score that you have that is in single parameter and it is 3, it needs to be monitored. The frequency of monitoring should be hourly, nothing more and nothing less. Okay, next letter is A. You assess Janet for signs of breathlessness, such as use of accessory muscles, seesaw breathing, or cyanosis. Okay, these are the things you assess the patient for. In every of your nursing care plan, you need to assess patient for something. Okay, next alphabet is T. In every of your nursing care plan, you must teach this patient something, right? Depending on the uniqueness of your scenario. What you're going to teach patient that is having congestive cardiac failure is not the same thing you are going to teach a patient that have fall and fracture. Please take note of this. Teach Janet deep breathing exercises and proper positioning to promote lung expansion. Yeah. Next to that is A. You administer all prescribed medications, monitoring effectiveness and side effects after 30 minutes. The next one is referral. For every of your care plan, you must refer this patient to a team. Yeah. So in this case now, Janet is having difficulty in breathing. The department you are going to refer Janet to is no other one than respiratory. Next one is inform. Right, you inform Janet on the use of call bell because it is hospital scenario. If it were to be a community scenario, you tell Janet to call her GP, 111 for non-emergency, and 999 in case of emergency. So finally, on that note is D, that is document all aspects of care as planned. It's as simple as that. So we are done with the first nursing care plan. The second nursing care plan identified for Janet is experiencing activities intolerance due to congestive cardiac failure. Your aim of care is Janet will participate in her activities of daily living within the limits of her capability. Yeah, the patient should not be put through rigorous task. It must be a gradual process, yeah, within their level of capability, what they can cope with per time. Right. So your reevaluation time frame today, your exam day in bracket open and close, do not forget this. 4 to 6 hourly or sooner if the clinical condition changes. You don't want to do it so frequently so that the patient will not be so exhausted. Moving on to the interventions now. As usual, you explain and discuss all aspects of care to Janet and obtain consent. Next to E is M. Monitor and record Janet's vital observations and escalate as per News 2 policy. Next on that list is assess. Assess Janet's ability to carry out activities of daily living, also a level of fatigue. A patient that is so fatigued should not be put to rigorous task. Yeah, it must be gradual so that they get used to it and they are not worked up. Next is T. Teach Janet on gradual involvement in activities. This will in turn improve her tolerance. Do not let it be so rapid. Gradually introduce the patient. Gradually get them involved in their activities of daily living. They will get used to it with time, right? Also, you should assist and involve Janet in her care while avoiding dependency. This is important. If you are too much into it, they will leave it for you, thinking they are relaxing. Still carry them along, but do not let them depend solely on you. Right. Next is administration of medications. Administer all prescribed medications, monitoring effectiveness as well as side effects after 30 minutes. Next is referral. Refer Janet to occupational therapy team for proper package of care. Inform Janet on the use of cowbell. Lastly, on that note, document all aspects of care as planned. That brings us to the end of care plan. We have successfully written 2 care plan for this patient. All right, let's move to implementation station. I will see you shortly. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left thumb, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of my thumb, vice versa. Rotational rubbing of my finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, yeah, I'm Kenny, one of the nurses that will be looking after you today. How are you? All right, the reason why I'm here is to administer your due medications for 1400 hour. Is it a convenient time, please? All right, before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, Janet James, Janet James. Your date of birth 0101-1992, 0101-1992. Your hospital number is 1234567, 1234567. Perfect. Can I confirm with you if you have any known allergy, please? Oh, you have none. It is properly documented in my notes that you have no known allergy. All right. How may I address you, please? All right, Janet is fine. Okay, so assessor, I can confirm I am with the right patient and I'm happy to proceed. Janet, is it okay to take you through your medication record chart, please? All right, so I have the hospital mark chart for Janet James. The date of birth 0101-1992. The address is 27 Dalton Group, Badley Green. The hospital number is 1234567. The height is 1.57. The weight is 74 kilogram. The body mass index is 25.6. The ward is cardiac unit. The consultant is Dr. Tolu. The date of admission is 4 days ago. The time of admission was 10:00 hour. The name of the prescriber is Dr. Tolu. The GMC number 1234567. The signature is properly appended. The blip number is 642. On the details of person administering medication, I will be coming back to enter these details after I might have completed the administration of the medication. Moving on to alert allergy sensitivity adverse reactions. Janet is not having any known allergic reaction, and the box for known allergy is ticked for Janet. Moving on to medication risk factor. There is no medication risk factor ticked for Janet. I move on to the next page. I still have hospital mark chart for Janet James. The date of birth is 0101-1992. The rest of information on this page is as the same as the previous. I have read and understood the code. If need be, I will be coming back to use appropriately. Moving on to once only medicine. The date is 4 days ago. The drug is furosemide. The dose is 20 milligram. The route is IV. The time required 500 hour. Prescriber signature and blip was properly appended. The time it was given was 12:15. It was properly signed by a colleague. Moving on to the next page, I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as the previous. Under prescribed oxygen, Janet is not a known CO2 retainer, so the box for no is ticked for Janet, and Janet is not on any prescribed oxygen. I move on to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as previous. Under antimicrobial, there is no antimicrobial that is prescribed for Janet. I move on to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as the previous pages. Under regular medicine, drug is digoxin. The date is today. Duration is continuous. The time is 1400 hour, which is my time. The start date 4 days ago. The finish date is continuous. Prescriber signature and blip is properly appended. It is a valid and legible prescription. All right, assessor, could you please confirm Janet's heart rate before I proceed to administering this medication, please? Oh, good to know. It's above 60 beats per minute. All right, thank you. All right, Janet, digoxin is a cardiac glycoside. It helps to improve blood circulation to your heart, thereby reducing your heart rate. Some of the side effects you may or may not manifest include and not limited to nausea, vomiting, visual disturbances, or headache. Are you still happy for me to continue, please? All right, thank you. I will not be signing this medication now. I will come back to append my signature as soon as Janet has taken the medication. I move on to the next medication, still under regular medicine. The second medication is furosemide. The date is today. The dose is 20 milligram. The frequency is QDS. The route is per hour. The duration is continuous. The time is 1400 hour, which is my time. The start date 4 days ago. The finish date is continuous. Prescriber signature and blip is properly documented. It is a valid and legible prescription, and I'm happy to administer. Again, assessor, before the administration of this medication, is it okay to confirm with you Janet's blood pressure? All right, thank you so much. It is 125/90. All right, meaning the medication is safe to be administered. All right, Janet, furosemide, it is a water tablet that helps in getting rid of excessive fluid from your body. All right, and some of the side effects you may or may likely not to manifest include and not limited to frequent urination, headache, or low blood pressure. Are you still happy for me to continue, please? All right, thank you. Again, I will not be signing this medication. I will come back to append my signature as soon as Janet has taken the medication. I move on to the next medication, still under regular medicine. The next medication is simvastatin. The date is today. The dose is 40 milligram. The frequency is once daily. The route is per hour. Duration is continuous. The time is 1600 hour. The start date 4 days ago. Finish date is continuous. It is a valid and legible prescription. The prescriber signature and blip is properly documented. However, simvastatin is not due at my time. and I move on to the next medication. I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as previous. Under as required medicine, the drug is paracetamol. The date is today. The dose is 1 gram. The frequency is 4 to 6 hourly. The route is per oral. The duration is continuous. The start date 4 days ago. The finish date is continuous. The prescriber signature and blip is properly documented. It is a valid and legible prescription. Right. Alright, Janet, can I confirm with you if you are still in any form of pain at the moment? Oh, on a scale of 0 to 10, 0 being the least and 10 being the worst pain possible, how would you rate the pain? Oh, you would say 6. That's still quite high. You are due for paracetamol. It has not been previously administered to you in the last 4 to 6 hours. So I'm happy to administer the paracetamol to you. Is that okay? So basically, what paracetamol does is a pain relieving medication. Right. Some of the side effects you may or may likely not to manifest include and not limited to nausea, vomiting, headache, or abdominal disturbances. Are you still happy for me to go ahead to dispense this for you, please? All right. Moving on, still under as required medication. So I will not be signing the paracetamol now. I will come back to append my signature after Janet might have taken the medication. Right. So still under as required medicine, there is no more medications documented under as required medicine. I move on to the next page. We have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as the previous. Under infusion, there is no infusion documented for Janet. And under omitted medications, I've not omitted any medication. If need be, I will come back to make use of this page appropriately. Alright, Janet. Here is the call bell as I will be stepping aside now to quickly prepare the medications. Is that okay? And I will be back shortly. Should you need me, press on the buzzer and I will be here. Is that okay? So leaving my patient bedside, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm the medication cupboard is under lock and key and will only be opened for the purpose of this medication administration? Alright, thank you. The first medication here is digoxin. So I have digoxin on my hand. It is not expired. The expiration date is February 2026 and the stock dose is 25 microgram. I will go ahead and compare that with the prescription to be sure it tallies with the prescription. So I have the same on my prescription, digoxin. The prescribed dose is 125 microgram. It tallies. I'm happy to dispense. So since it comes in 25 microgram per tablet and the prescription says 125 microgram, so meaning I'm going to carefully dispense 5 tablets in an aseptic manner from the bottle to the lid. Right, and from lid carefully to the pot without my fingers coming in contact with the medications. I put that aside. I will secure the lid to the bottle. Right. The next medication is furosemide. I have on my hand furosemide. The stock dose is 20 milligram. It is not expired. The expiration date is February 2026. I will go ahead to compare that with my medication chart to be sure it's the same prescription. I have on my chart the same furosemide and the prescribed dosage is 20 milligram. It tallies. I'm happy to dispense. All right. Also, in an aseptic manner, from the bottle to the lid, making sure my hand does not contact it, and I will carefully transfer that into my medicine pot. Put that in my tray, and I will secure the lid to the bottle. I'll keep it. Moving on to the third medication, I have paracetamol. I have paracetamol on my hand. The stock dose is 500 milligram. It is not expired. The expiration date is February 2026. I will go ahead and compare that with my prescription to be sure it tallies. I have the same paracetamol prescribed, and the dosage is 1 gram, meaning I will be dispensing 2 tablets of paracetamol from my container. Right. So, in the same manner, aseptic technique should be ensured from the container carefully to the lid, and from the lid to the medicine bottle in an aseptic manner, making sure my hand does not contact it. I will carefully secure the lid to the medicine bottle. I'll put that in the tray. Right. Prior to every medication administration, the 6 medication administration principles need to be ensured. That is, the right patient, the right medication, the right dosage, route, the right time and date, the validity of the prescription, and the proper documentation after administration. I have all my 6 rights in place, and I'm happy to proceed. Now, I will go back to my patient now to administer the medication. Leaving for my patient's bedside, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still happy for us to continue? All right, thank you very much. Before we proceed, could you please reconfirm your full name and date of birth while I double check with my paperwork as well as against your wristband again, please? All right, thank you. I have Janet James. Janet James. Your date of birth is 0101-1992, 0101-1992. Your hospital number is 1234567. 1234567. Right. You said the other time that you have no known allergy. Am I correct? All right. It's properly documented here that you have no known allergy. Right. So, assessor, I can still confirm I am with the right patient, and I'm happy to proceed. All right, Janet, I have your medications here with me. Right. Would you like to take the medication with water or squash? Oh, water is fine. Perfect. Right. Do you want to take the medications together, or you want them separately, please? All right, you want them together. Fantastic. All right. So, do you want the medication first or water first, please? Oh, the medication first. Here you go. Right. And here is your water. Good. Right. Could you please confirm you have swallowed the medications, Janet, by opening your mouth? Oh, fantastic. So, assessor, I can confirm Janet has safely taken her medications. Right. Okay, Janet, I'll be stepping aside now to quickly document what I've administered to you, and I'll be back in a moment. Is that okay? All right. Leaving Janet's bedside, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still comfortable? Right, so I'll still be with you for some minutes. After I might have left, if you have any concern, here is the call bell. Do press on the call bell, and we'll be here to attend to you. Is that okay? All right, so that will be all for now, right? So I'll be leaving you now, okay? So leaving my patient now, finally, I'm going to lock the medication cupboard again and hand over the key to the assessor, right? Also, I will clean the equipment used and get them prepared for the next use. Right. So I'll go ahead now and perform my final hand hygiene following the 7 steps of WHO standard. All right, colleagues, it's as simple as that. That brings us to the end of implementation station. So let us proceed now to hand over this patient in evaluation station. I will see you shortly. In this station, contrary to popular opinion that you should jot down about 4 minutes out of the 8 minutes allotted to this station, I would strongly advise that you don't jot anything. Right. Everything you need for this station is readily available in all of those scenarios that you have previously done. So you can literally read out from those scenarios appropriately. Right. So join me as I hand over this patient in less than 8 minutes. Okay. So using S-bar approach now, let's hand over this patient in less than 8 minutes. S, which is the situation, is basically the introduction of yourself, your patients, and the reason for handing over. I'm Kenny. I'm the attending nurse from cardiac ward. I on to the nurse in pre-discharge lounge. Oh, good. I'm here to hand over Janet James with hospital number 1234567, who lives in 27 Dalton Grove, Stockport, and the date of birth is 01/01/1992. Janet is being transferred here prior to her final discharge home later today. We are done with situation. Moving on to background. Janet is a 78-year-old female with an history of hypertension, type 2 diabetes, and ischemic heart disease. She was diagnosed with congestive cardiac failure 2 years ago following an anterior myocardial infarction. She has had multiple admissions in the past years for fluid overload and shortness of breath. She lives alone but have a care package visiting twice daily. Her regular medications include furosemide 40 mg once daily, digoxin 125 microgram once daily, simvastatin 40 mg once daily, paracetamol 1 gram as required. She has no known allergy. She was last seen in the heart failure clinic 3 months ago. Her ejection fraction was noted to be 35% on a previous echocardiogram. Upon Janet's initial assessment, she had a total NIL score of 4. She had respiratory rate of 28 cycles per minute. That made her to score 3 in a single parameter, and her SpO2 95%, where she had a score of 1. For this, the frequency of monitoring was every hour because she had 3 in a single parameter. Moving on to assessments. The most recent assessment for Janet is as follows. The temperature is 37.1. The pulse is 70 beats per minute. Respiration 20 cycles per minute. SpO2 96%. Blood pressure 120/80 of mercury. There is a marked improvement in the respiratory rate now compared to when it was 28 cycles per minute, with a NIL score of 3 in a single parameter. Is now 20 cycles per minute. Also, the SpO2 of 94% is now 96, where she was scoring 1 previously. Her latest frequency of monitoring is now 12 hourly, meaning she is now having a total NIL score of 0 compared to when she was having 4 and 3 in a single parameter. The two nursing problems that were identified for Janet: first, she was having difficulty breathing with a respiratory rate of 28 cycles per minute. She was monitored hourly and the vital observations were documented accordingly. Due medications were administered. The effect and side effects were monitored after 30 minutes. Janet was taught deep breathing exercises to promote lung expansion, thereby facilitating proper breathing. She was also referred to cardiac team for proper package of care. The second nursing problem identified was that Janet was experiencing activity intolerance. Janet's level of fatigue was assessed. She was involved in her activities of daily living and dependency was avoided. Due medications were administered. Effectiveness and side effects were monitored. Janet was referred to occupational therapy team for proper package of care. And for my recommendation, I would recommend you monitor Janet 12 hourly according to the latest news 2 score. And reminder to be sent to those team earlier mentioned. Also still keep involving Janet in her activities of daily living, but ensure dependency is avoided. Towards mentioning that Janet should still be encouraged to engage in deep breathing exercises to promote lung expansion, thereby facilitating proper breathing. That will be all from my end. Do you have any question for me at all? All right, fantastic. In case of any further queries, do not hesitate to contact us and we will be more than happy to attend to you. Thank you so much for your time. I will see you again. Dear colleagues, it's as simple as that. You can do it. Yes. That brings us to the end of APIE for a patient that is having congestive cardiac failure. It could be that simple. All right. In case you feel you need to sign up for classes, do not hesitate to reach out to us. We'll be more than happy to assist you in the little way we can. And success is definitely your portion. I will see you again in my subsequent videos. And until then, keep practicing OSCE. Bye.